Hi, it's Erik Paulsen and welcome to our Correspondence Corner this week. I'm standing in Statuary Hall next to the bust of Václav Havel, which was just unveiled this week, and he's a special figure in the world history. Since the falling of the Berlin Wall, he was actually the first democratically elected individual from the Czech Republic, then Czechoslovakia, so we honored him promoting freedom and democracy around the world just this week in the United States Capitol. But now we're going to get to our questions, and they've got some great ones this week, and the first actually came by email from Michelle and Edina, and she writes in, "Dear Congressman Paulsen, I wish to express my concern that Medicare is systematically denying the most severely disabled members of our society the ability to communicate. Many people with impairments such as ALS, which is Lou Gehrig's disease, cerebral palsy, spinal cord injuries, and others are unable to speak or even move and are dependent upon speech-generating devices to communicate. Medicare is now removing access to these critical communication devices. I ask that you fight to ensure that these debilitating diseases, those that have these debilitating diseases, have access to the devices that they need to communicate." Well, first of all, Michelle, thanks for sharing those great comments. And I will just tell you, I share those concerns because there are hundreds of thousands of patients and individuals that have diseases like ALS, cerebral palsy, and it left them unable to communicate with their loved ones or with others. And there are technologies that exist today, such special devices, that allow that communication to take place. But there was a government agency that was proposing not for those patients to not have access to those devices. I helped lead a letter to that agency drawing attention to the fact that this was going to take place. They have now rescinded that request and are moving in a better direction to make sure those devices are going to be available for patients. Now for our next question. We got an email also from Kim in Deephaven who wrote in, "Dear Erik, I wanted to thank you for your work on raising awareness for meningitis B. This horrible disease has needlessly taken too many young lives during the last few years. I urge you to continue to fight to make sure that students in the U.S. have access to the vaccines that can save lives. Our students should not be forced to suffer due to ineffective Food and Drug Administration." Well, Kim, you're absolutely correct. I've been spending a lot of time and focus trying to make sure that our American patients and students have access to this vaccine for meningitis B, which is available in 34 other countries, Canada, Australia, the EU, but not in the United States. Just a few weeks ago, another patient, and sadly a college student in California, passed away from meningitis B. The good news is we've been putting pressure on the FDA. They've now approved one vaccine. We're hoping that vaccine is going to move through the regulatory process and be available on the market soon. I'll continue to lead that effort as I went to Canada with many other college students and individuals that were also unfortunately forced to go to Canada to be vaccinated recently. Keep sending in your thoughts, your ideas, your questions. We had a lot of healthcare concerns and thoughts that were shared this week. I look forward to communicating and talking to you in the future. Always reach out to me on Twitter, Facebook, of course on my website at paulsen.house.gov. Have a great weekend and week.